Practice does not make perfect, only perfect practice makes perfect. Hi everyone, welcome to our step-by-step tutorial. Today we are going to learn application of manual ID gel cut system. Good laboratory practice, or known as GLP, in blood banking were to use a risk-based approach to ensure safeguards where in a place for patients undergoing transfusion or immunohematology testing, and for the standard to support latest practice. How is this GLP or good laboratory practice can be used in our daily lab work? By physical checking appearance. For gel cut, check for expiry date. General inspection of the gel cut are no dry, no bubbles, and no cracked. Store the ID gel cut at 18 to 25 degrees Celsius. For red cell reagent physical inspection, check for expiry date, no hemolysis. Store the reagent at 2 to 8 degrees Celsius. Ensure reagent reach to room temperature before testing. However, transfusion guidelines recommend regular checking of test materials, test methods, personal working procedure, and automated equipment or instrument used. The control sample should always have the same characteristic as a patient sample and therefore be treated identically. These activities are intended to ensure accuracy and safety of the blood grouping serological results. The control should be carried out at regular intervals. IHQC Modular can be used for quality control in blood banking. IHQC Modular 1 is known blood group of A RHD negative and IHQC Modular 2 is known blood group of B RHD positive. With these two different blood groups of QC samples, laboratory can determine the quality of antisera, reversal, equipment and methodology. At the same time, IHQC Modular 1 contain NTD less than 0.05 IU per ml is standardized against the WHO, which is controlled by an external accreditation reference laboratory by continuous flow assay. IHQC Modular 2 contain anti-Duffy-A gives a positive reaction with a titer of less than 4 plus reaction against Duffy A-pos and B-pos cells in indirect anti-human globulin testing. These two known antibodies able to check the functionality of AHG in Liscum card and screening cells. Again, pipetting technique also part of good laboratory practice. Right pipetting gives right results. Red cell suspension is added into microtube before the plasma or serum will create a barrier over the gel suspension, thus avoiding neutralizing of AHG by serum or plasma IgG proteins. This tutorial ends here. Learning process never ending. Don't let your learning lead to knowledge. Let your learning lead to action. See you again. Bye.